always remembered something that one of my mentors told me was that, our participants are our most valuable resource. We wouldn't be able to do the research that we did without them, and they're worth more than their weight in gold in offering their time and their energy to come to participate in our research study. So I've always valued that. I think also from, my clinical experience, everything that we do as a healthcare team was centered around the patient and around their families. And so as researchers, it makes perfect sense that we do the same thing. And what I'm learning through patient engagement is that it's not just, including them as research participants, but also including patients as kind of through the whole research process, from conceiving the idea to developing the idea to carrying out the project and then disseminating it at the end. So it made perfect sense and great alignment with, I think, my approach from my clinical practice from before. There are a lot of my colleagues in the School of Rehab Science that are very engaged in patient research, patient-engaged research, patient-oriented research, community engagement, and it was something that always inspired me. I'm very new. I think of myself as very new to this process, so I didn't know where to start. I was fascinated by it. We had talked about it as a lab group, but then when the opportunities through the McMaster Collaborative Health and Aging came up to get some grant money, and Kenny Noguchi had applied for it, it was kind of the perfect opportunity for us to get involved. Really gaining the perspectives of our partners is always so enlightening and so insightful. I think that we try to do research that we think is very clinically relevant and clinically applicable, and where we hope that it can be helpful to clinicians, but also, of course, to the people living with stroke. But then when you hear their perspectives and raise issues that we hadn't thought of, it's always very grounding to me, I think, to be able to get their perspectives. It really has been, nurturing relationships. I place very high value on collaboration and establishing relationships with all the people that I engage with, whether it's students and trainees, whether it's collaborators, whether it's, our partners, patient partners. So being able to develop and nurture those relationships and see them grow and is the most fulfilling thing. And then when I see our patient partners who might have, this might be their first role with research, not as a participant, but actually as a advisory group member or a member of the research team, kind of get themselves grounded in what's the research process, and how can I contribute to this meeting, and how can I contribute to this research project, and feel more and more comfortable being able to then voice what they want to say, or feel like they are contributing. I get a lot of fulfillment in watching that, because to me it means they've arrived at a place where it can be mutually beneficial between us and our patient partners. There are lots of people that are around that have lots of experience, and I would say to use those people, use the resources that are available. Groups like the collaborative are excellent resources to be able to talk to people and learn from others about how to get started.